Okay, thank you very much, Tamara, for the wonderful morning. Here is 7:12 in the morning, so we are thankful for HealthServe Australia for putting us together and has enabled one project that to be done in Indonesia. Allow me to have to share screen. Yeah, we are from Yayasan Suluk Kasih Bangsa. In English is the National Torch of Love Foundation. And here is me and my wife and other resource speaker for the training. So we have been doing this training for community healthcare worker volunteers. We call them volunteers because in Indonesia, this is the work of, they call it health cadres. That means it's the health worker volunteers because they are not paid, and the government doesn't recognize them as a medical medical related person or staff, but it's more like volunteers working in the community centers. Okay, I'm sorry. I think, yeah. Okay, this is the one. So our foundation was recognized by the government in 2018. And ever since, we have started to do training, and our purpose for the training is to, let me move. Okay. Is to equip especially those cross-cultural ministers, those who do work among the Kedar and Bai people, preferably insiders. So this sharpen the effective access ministry among focus people. That's why those whom we train will only for those who work among the UPG, unreached people group, and UUPG, unreached and engaged people group. So this thus will compel more mission workers to be in the front line of medics using knowledge as community healthcare worker volunteers to serve in the mission fields. And so this will change the focus of health issues from curative or rehabilitative to preventive and promotive, from personal to community approach. And then this will cease and change perceptions of disasters from calamities into opportunities and from chaos into ecos. And then our purpose is also to raise up non-medical persons, those whom we train. Those are entirely non-medical persons, and since these are the cross-culture ministers, so they come from non-medical backgrounds. So we want to raise up these people from their respective communities, training them with medical knowledge and skills within the border of community health worker volunteers to serve and bring impacts back into their communities. And this will enable more areas and communities untouched and unreached by public health services to be reached and touched through the presence of community healthcare worker volunteers. And of course, this will be an alternative platform for the middle class people in the city areas through the training of caregivers for the sick, elderly, and palliative patients. So also this will give reasons for the cross-culture ministers to visit contact persons in their communities, because a lot of these cross-culture ministers, they have got to have reasons to visit the people in their communities, and many of them are working, must have their own work or job, otherwise they will be kicked out from their communities. So we did training for these cross-culture ministers from 2016, and then in after the earthquake and tsunami at Palu, Central Celebes, HealthServe Australia did the support for the training, and we did 18 of the people they were trained, and then we did training also on June 5th to August 7th through online and offline training with total 50 persons, and with total today 437 persons trained. And we are still waiting for the upcoming evaluations of the project, because we always did the 2 months evaluation after the training to see how effective they are in the field. So we are still gathering the evaluation. Maybe I will send the evaluation after the training to you, Tamara, so that we can have better evaluation of things getting on after the training. And also we did advanced training in 2020. So we also, with the help of HealthServe Australia, we were able to distribute PPEs during the pandemic, and these are the whole numbers distributed to the people, to the medical workers and the hospitals. So in Indonesia, population in 2022 is 276,000. 276 million people spread in 34 provinces. So the UPG and UPG estimated at 62.5%. 62.5%. That means 172 million people. And the intellectuals at 5 to 10% of population. It means there is a need to reach middle and grassroots of UPG and UPG, among them 155 million persons. So we did training for community healthcare worker volunteers from those who reach out to UPG and UPG, spread to 18 provinces, mainly in remote and isolated areas, to reach out to 56.2% of the population. And we thank God, after the training also, we still continue to be in contact with them through WhatsApp group support. So this through WhatsApp group, they can ask questions regarding health and medical problems they face in the field, and they will receive updates of knowledge and skills through periodical training via WhatsApp, and receive updates of emergency needs in disaster conditions. They also will receive information like the current kidney failure among the children, and then they receive the updates and what they should do. This enable them to pass on the information to the people they serve. We also cover the expedition and flight fees, so they can get many of them are from Sumatra or Borneo or other parts of Indonesia, such as Celebes or Sulawesi. Of course, the medicines or the medical instruments there will be more expensive compared to the Java Island. So we provided them with medicines from Java Island sent to them. They paid the price of the medicines from Java Island. That means Java price, and we cover the expedition fees so that they can get the cheaper price. And this will enable them to refill the first aid bags that we have already sent to them and train them with. Of course, we also did the advanced training to support them that we have done only once because of the need in the field. And this will enable them to upgrade their skills and face more challenges and problems in the field. And we did the training for them before the pandemic. It was 5 days, 4 days seminar. Seminar and workshops before pandemic, and during pandemic we did 25 hours of online training via Zoom application and 20 hours through online on-site training. That means 3 days, 2 nights to train them. So what we did was giving the materials on introduction and explanation about basic health life skill training, contribution of community healthcare worker volunteers, their duties and boundaries, medical administration management concepts, integrated management for sick toddlers, and balanced nutrition, and anamnesis techniques and physical examination, first aid pack, how to use it, first aid for emergency and accidents, first aid for diseases, and then how to do palliative care, handling diseases around us, like HIV, tuberculosis, diabetes, geriatric change, and COVID. At least they know the issues and they know how to handle them by reference to the nearest healthcare centers or the nearest counselors for HIV patients, and dental health promotions and preventions, nursing and home cares, periodic health checks and common health problems among the elderly, the skills to the health education and promotions, health reproductions, and creating and setting up healthcare programs for community, and so on according to the situations, such as if there are disasters, what they should do. And then we did we give them equipments because there are so many health seminars, but many did not work well because they don't have needed equipment. So we provided them with for each community healthcare worker volunteers with one first aid bag, which costs about $200 equal to 2.8 million rupees. And then each bag contains OTC, on the counter medicines. That means they can get the medicine on the store or across the nation. And then blood pressure tensimeter, thermometer, stethoscope, emergency kits, stretcher, wound cares, and so on. These, of course, exclude mid-rent of location and other costs. The hardest, most challenging, and most expensive part in any community healthcare worker volunteer training is to prepare and equip each of them with the first aid bag. These are the first aid bags that we provided for them. This is the customized first aid bag that we ordered from the local garment makers. So they did make the first aid bag for us. And these are the equipments that we provided for them, so that they were able to use, such as scissors, and then for the if there are case of neck brokenness, and then other instruments such as wound cares and so on. This is the foldable stretcher to help them in case of emergency situation in small villages or in the dense population, where in small alleys that cannot be reached out by the ambulances. So they can use the stretcher to help them to bring the patients out of the villages. So we provided them with certificate because we are recognized by the government. So we were able to have the educational organization wherein we were able to input their names into the into the government website, so that they are recognized as those who have gone through the training in our educational center. So these are the people that were involved, the resource speaker. One of them is from Australia. Today she returned to Australia. She is Dr. Emma Barrett, was from Tasmania. So she was able to assist us in the Kandari training. And today she returned to Australia due to the pandemic situation, also the family situation that needs her. And what we have done, we coordinate training for those who work together and have the concerns for UPG and UPG. So these are the training that we were able to carry on. These are the students. This is at Kandari, Southeast Sulawesi. During pandemic, we have to do the compulsory rapid tests for those whom we train, and the social distancing. So they learn about first aid bag, how to use them and carry the bag. So whenever they go to the local villages or remote areas, they brought the bag together with them, and they were so welcomed by the people. So even the people call them doctor, even though they are not doctor, they just volunteer. But through their service, a lot of people came to know Isa al-Masih, the term for Jesus Christ, in the Kedar and Nabayot, among the Kedar and Nabayot people. So thank God, through this, they are able to go and bring more people, not only to be treated medically in case of treatment that needs more get more treatment and focus and concerns. They refer them to the local community healthcare centers. So they learn about how to do measure blood pressures, and they also did we trained them during training. Also, we did medical games and gyms, and we did them. One of the most important part is to treat the diarrhea is the oral rehydration solution. We taught them how to make the ORS. A lot of failure due to no knowledge or less knowledge of ORS, but through the training they were able to make a good ORS, good taste ORS for themselves to drink. Some in cases during the training, many put more salts compared to sugar, so they laugh out among themselves when after they have tasted the ORS. So we taught them how to move victims from disaster areas and how to serve home cares, and did the more balanced nutrition in disaster areas so that the children will have better access to nutrition. Also, we teach them how to do in cases of brokenness, sprains, and slips, how to treat them. We have like this one with hijab. She's a believer in Isa al-Masih, and she did a very well job in bringing people to come to the knowledge of Jesus Christ. And we treat them we taught them also how to do the CPR and Heimlich maneuver, and also cases of choking, breathing difficulties. We also taught them how to treat varieties of wounds. Like there are here 6 types of wounds that need attentions and treatment. We teach them of simple teeth diagnosis and simple water treatment in disaster areas. So these are the works they have done in the communities. And one of the cases, I spotlight 2 cases done by the local community healthcare worker volunteers. This case was found in August 26, 2020. And an elderly woman living in an island in remote areas in near Kendari, South Celebes. Wound due to diabetes mellitus started from just a small boil. And then referred to hospital on September 23rd, 2020. After operation due to distance and finance, because she lives in an island that needs time and traveling costs, that at least 2 hours of traveling to the nearest local healthcare centers. So since the finance and the cost of traveling, this stopped her from making up to the local healthcare centers. And then this wound was taken care by community healthcare worker volunteers using the wound care treatment knowledge that they have received. And then in 2020, November the 6th, we see today on the latest development is the wound was fully closed and fully recovered. So these community healthcare worker volunteers have done their jobs of finding the sick, doing referrals, and taking care of the wounds and accompanying the patient always. And also we find almost the same situation of wound treatment. We find that in 2022, one of our local volunteer community health worker found that this patient on 27th October 2022, this wound is due to the nail punctured wound, and also the patient had diabetes mellitus, so this wound was not healing very well and was not treated very well also by the local government healthcare center. After that, he was brought to her, the community healthcare work volunteer, and she treated the wound, the situation after the cleaning, and then after using iodo soap and anthracite, the wound is getting well on November the 3rd. And then on November 17th, the latest report of 17 days of treatment is like this, so it's still growing. And we are still working out to receive the latest update from her. But after looking the situation, how the wound is getting well, so we find that that she had done very good work by finding the sick, even if it's the sick family that came to her and doing referrals, taking care of the wounds, accompanying the patient always. And today, the whole family came to receive Isa Al-Masih as their personal Lord and Savior, and came to believe in Isa Al-Masih. So we thank God for the work. And another example is one of the from one of our community health worker volunteer who work among the Baduy tribe. Baduy tribe is located in Banten province, West Java. So Baduy tribe is well known to isolate themselves from outside world. Although their position is only 160 kilometers from Jakarta, that means it's not very far away and in Java Island. And one of our community health care worker volunteers have received the trust of Baduy tribe to help them in health areas. So the training here is receiving together with on the counter medicines and medical instruments in the first aid bag for community health worker volunteers, enable him to be able to become a great help for Baduy tribe in health areas, especially during the pandemic situations. So he just walked around the community and did the medical checkups and medical referrals in case of heavy situation. And these are the reports from the evaluations from those whom we train. They said that this have enabled them to be more effective. People do not raise up suspicions anymore about them. They were well received by the community, and then they were able to go around. And even after this, some of them are able to go and open up a new areas that will bring not only more people to come to know Jesus Christ, but also to be able to receive better healthcare and better attention for their problems. So we thank God for HealthServe Australia that was able to assist us through one of the projects at the Bandung Medis, so that these cross-culture ministers who work among the UPGs around Western Java and also at the South Sumatra were able to 50 of them were able to be trained. So we thank God for HealthServe Australia, and thank you, Dr. Michael Berg, and also Tamara, for all these cooperations thus far that we have done together. And warmest regard from the whole team from National Trust of Love Foundation. Thank you very much.